ये वीडियो हमारे एक सब्सक्राइबर के कारण है। उनका कहना था कि डायबिटीज़ की पूरी जानकारी किन कारणों से होता है, तो उन्हीं के कारण आज हम बनाए हैं एटियोलॉजी ऑफ डायबिटीज़, मतलब डायबिटीज़ के कारण, बाय डॉक्टर प्रदीप कुमार। और अगर आप भी अपनी लाइफ को हेल्थ को लेकर सजग हैं तो हमें सब्सक्राइब करें और लाइक करें, और किसी टॉपिक को देना चाहते हैं तो कमेंट करें। तो सुनते हैं।
From myself, Dr. Pradeep Kumar. Today we have a very interesting topic, and that I want to discuss with you and share my thoughts with you. This is regarding the emerging concept of inflammation and the role of inflammation in etiology of diabetes and in the progression and staging of diabetes and complications. So, as we know, diabetes is not an stand-alone condition. The spectrum of metabolic diseases like cardiovascular disease, dyslipidemia, and diabetes, they all arise from a common soil. And that common soil is genetics, sedentary lifestyle, obesity, and now there is increasing awareness in the role of inflammation that is becoming more and more prominent. So let us talk about inflammation first. So the inflammation can be of two types. The first type we call as classical type, that we are very much aware of, is the inflammation where we see the inflammation or feel the inflammation in the form of the redness, swelling, pain, and that is called classical or acute inflammation. But there is another category which is called silent inflammation, where there is no swelling, no redness, no rise in temperature, no pain, because it is a low grade inflammation that does not cross the level or cross the threshold where the pain can be generated, the redness can be generated. But this low grade inflammation can go on for a long time, months and years, and due to that the metabolic complications arise, the metabolic conditions arise, and that has etiology in causation of these metabolic diseases, especially diabetes. So what are the predisposing factors? The one is the adipose tissue. As we know, people who are obese have a higher risk of having diabetes, because if there is inflammation in adipose tissue, that is a huge area of the body, and that leads to a systemic inflammation, and the systemic inflammation can eventually result in type 2 diabetes. So we know that silent inflammation can cause diabetes. What can we do about it? And before we do anything about it, we need to know why it happens. There is a strong role of diet in this inflammation, especially inflammation of the adipose tissue. One of that is the excess use of refined high glycemic load carbohydrates. In last some decades, we have been increasingly using less of rough diet or roughage and more of refined diet, which contains a lot of high glycemic load carbohydrates. That could be one of the reasons for high inflammation, systemic inflammation leading to diabetes. The next is refined vegetable oils. That has a high amount of omega-6 fatty acids and a low amount or negligible amount of omega-3 fatty acids. So that could be another reason why this metabolic disease is coming up like an epidemic. So if we have to modify our diet to get better result, we have to reduce the refined high glycemic load carbohydrates like bread and cakes and things like that. We have to reduce the refined vegetable oils, that is omega-6 fatty acid, increase the long chain omega-3 fatty acid, and also a lot of monounsaturated fatty acids. So that is the that is the main things. But in a gross term, what we should eat and what we should having the dietary pattern. The carbohydrate, protein, and fat needs to be in a good balance, and that balance is dictum is 1, 2, 3. So the fat should be 1%, the protein should be 2%, and the carbohydrate should be 3%, and that 3% should be a low glycemic load carbohydrate, not the high glycemic load carbohydrate. So we should try and avoid the bread, pasta, rice, and potatoes. The protein has role to stimulate satiety, and that reduces the excess eating. So that is another thing we should be paying attention to. There should be adequate amount of protein in the diet. And finally, the fat, there is requirement of fat for a normal body function, but that should not be too much. So that should be 1 in the 6 part of the total macronutrients. When we talk about the fat, we have to be careful what we are having. So we should be having a lot of monounsaturated fat, and also at least 5 grams of long chain omega-3 fatty acid per day. That will reduce the chances of the inflammation, the slow inflammation or the silent inflammation that can result in metabolic syndrome. So in summary, the diet should be of a good balance of fat, protein, and the carbohydrate. Carbohydrate should be 3 out of 6, the protein should be 2 out of 6, and the fat should be the remaining 1 out of 6 portion. We should have less and less amount of omega-6 fatty acid and more of omega-3 fatty acid, and also a lot of monounsaturated fatty acids in the fat. There is increasing role of antioxidants in the diet, and the proper balance of the minerals and the vitamins in the diet, because they form part and parcel of the antioxidants. If we follow this pattern, we can hope that as the time passes and our dietary habit changes back to healthy side, we may be able to reduce the silent inflammation, and in that way we can probably put a check on increasing incidence of metabolic syndrome generally, and especially the diabetes incidences by diet. There are other issues that we can discuss in another session. For this session, I will conclude here and would love to have some feedback and comment and questions. Thank you very much for your time. Thank you. Bye.